September is Sickle Cell Awareness Month. Sickle cell disease is a serious and painful condition affecting an estimated 100,000 Americans and millions of people worldwide. For those at risk, knowing your status is paramount to the health of future generations.
We are made up of half of our fathers and half of our mothers. So we have genes, half the genes from one parent, half genes from the other. And sickle cell anemia is a genetic condition which requires both copies of your hemoglobin gene to be abnormal. So the people who have one copy, the parent who has one copy of the sickle mutation, but the other copy is normal, are said to have sickle cell trait, which is also known as the carrier state. And those people, for all practical purposes, don't really have any problems, any symptoms.
My mom had told me about my sickle cell status. She, in the past, had mentioned that I was AS, but that's all I knew. And then the little that I knew from nursing school, that sickle cell patients had pain. I did not know all the complications that sickle cell patients have. I just knew about the pain. They did the newborn screen when he was born, and I received a letter from the health department in Richmond stating that he might have sickle cell. So we had to do the hemoglobin electrophoresis 2 more times to confirm the diagnosis.
So in the state of Virginia, as well as all over the country, all newborns are screened for sickle cell in order to be able to identify the complications of sickle cell before they appear. The home institution where the baby was born, as well as the pediatrician, get the results, and if there's an abnormal sickle cell screen, the children are referred to the local comprehensive sickle cell center. We are the local comprehensive sickle cell center in Northern Virginia.
It's important that people know their sickle cell status because sickle cell disease is a genetic condition. You inherit it from your parents. So if we know, the people who are carriers know their status, there are ways now to prevent having a child or baby with sickle cell disease.
Just knowing your status, both you and your spouse, knowing the status of your sickle cell. Also knowing the different options. I did not know that IVF was an option. If I knew, that would be the best option for me, because it's really difficult to see my son come in every 3 months, getting his blood drawn. It's difficult for me as a nurse because I see patients with sickle cell.
Sarah, you know why you come to see us?
Because I have hydroxyurea.
You take hydroxyurea? And why do you take that medicine, do you know?
Because my sickle cells are straight. They're supposed to be round.
And what does hydroxyurea do for that?
It makes them round.
Good for you. The major advance in the last 2 or 3 decades has been the advent of hydroxyurea medication, which isn't an old medication to be around, but we learned to use it for sickle cell disease, and it's a pretty amazing medication. It really helps prevent a lot of the complications of sickle cell disease, so that all children with severe forms of sickle cell disease should be on hydroxyurea since infancy. There is a cure for sickle cell disease right now. It is bone marrow transplant. The bone marrow, the state-of-the-art technology right now is that you need to have a donor that is immunologically matched with the patient. Usually that's a sibling, and that works very well. There are other alternative donors that are less well matched, and they work as well. They're just higher risk, and research is trying to figure out how to do that better. The frontier right now is gene therapy. So people are experimenting. actively on how to go in and correct that abnormal DNA that's making the sickle hemoglobin, and that is very exciting. You know, there are other genetic diseases that have been eradicated. So because we know the genetics of sickle cell disease, we know how to prevent it. If people just know their sickle cell status, then they can prevent passing sickle cell disease on.